Hello, this is Dr. Grande. Today's question asks, what are my opinions about self-disclosure in counseling? And the self-disclosure being referred to here is self-disclosure on the part of the counselor, not the client. Now, self-disclosure is a controversial issue, and it has a number of facets to it. So first I'm going to start by dividing self-disclosure into a few categories. And some of these categories we see in the research, and some of them I use. So the first is information that has to be disclosed based on rules and regulations, like the license status of a counselor or what type of training they've had. In most places, this is information that has to be disclosed. So this quantity of information, as compared to all that can be conveyed in counseling, is fairly small. In the second category of self-disclosure, I have some different information that's routinely shared, that's not sensitive. For example, if a client asks something about an upcoming storm, I wouldn't expect a counselor to say something like, I don't want to discuss whether I get information from TV or the internet, or that just seems like it's routine. The weather is a topic that's routinely talked about. Another area in this category would be information that's inevitable in terms of whether it's going to be discovered or not. So if you have a degree on the wall and it says what school you graduated from, the client is going to see that at some point, and it seems odd to not discuss that openly. And the last part of this category would be small talk. And this is similar to what I talked about earlier with information that's routinely shared. So small talk is normal, and it could be argued, of course, it's not therapeutic, but it's not unusual, particularly at the beginning or the end of a therapeutic session, to have some small talk. This isn't really what I mean by self-disclosure in the controversial sense of self-disclosure. Now, the last category is the area that gets more controversial, and this is personal and or sensitive information, and I divide this in two ways. So this third category has two subcategories. Feelings about the client. So if a counselor is proud of a client, if they're worried about a client, and that's disclosed in session, that's a self-disclosure of a personal and sensitive nature. And the second subcategory here would be external information. So if the counselor discusses something about their personal life, they bring that into the session, or about the logistics of their life. For example, what type of house they live in, what type of cars they drive, who they know in the outside world, what type of relationships they have. It's easy to see how sometimes this external information category could be mixed with information that's routinely shared as well. So it's not always clear where the self-disclosure would be put in these categories. So as I mentioned, self-disclosure is controversial. And we know a little bit about self-disclosure from the research, but it doesn't always help us resolve the controversy. For example, self-disclosure tends to vary a lot by modality. If we look at the psychodynamic modality, for instance, self-disclosure is typically frowned upon in this modality. Now, if we move to a modality like cognitive therapy, self-disclosure is often encouraged. And specifically, if we look at cognitive therapy used to treat substance use disorders, it's not unusual in substance use treatment, if a counselor has a history of substance use, for that to be revealed at some point during therapy. So it varies by modality, and it can also vary by timing. So I talk about timing, I'm talking about the entire therapeutic process. So if a client is being treated for symptoms and that treatment lasts 6 months, toward the end of that 6-month period, we would expect to see more self-disclosure than we would early on, if any self-disclosure takes place. There's also variance based on the symptoms that a client presents with. Research shows us that when clients are more symptomatic, self-disclosure by the counselor tends to be lower. The research is mixed on whether self-disclosure is effective in counseling. We have all different types of results, and there's no consensus, which makes this issue of self-disclosure even more difficult to contemplate and to figure out. Now, when we talk about mental health counseling, of course, there are a few codes of ethics that apply depending on where somebody is and what organizations they have joined. And we look at other mental health treatment professionals, there are also sometimes multiple codes of ethics there as well. Generally, though, when we look at ethical codes, we would expect to see that a mental health clinician or a counselor has to do good, do no harm, and that the welfare and the interest of the client needs to be first. That needs to come first. So when we think about self-disclosure, we're really weighing the ethical codes, all of them, including those principles, and trying to figure out if it's something that's going to be useful or harmful, and if it really focuses on the client's needs and interests. Now, on this topic, sometimes I've heard that, as I mentioned, I have that category of information that is going to be inevitably learned, right? That's in that second category I have. And I've heard individuals say that if a client can find out anyway, if it's something that is public or functionally public, that it's really not a self-disclosure. But I have a different opinion when it comes to this. I think there's a difference between knowing and revealing. So there's information about a counselor that a client is going to be able to figure out or find out without any trouble or with some work. But either way, it would be, as I mentioned, public or functionally public. But the process of revealing is something different. That's something that would be done in session. It could be a sign of trust. It's active and not passive. So the process of revealing needs to be considered, more so than what can be found out publicly or not. Those two constructs aren't the same thing. Also on the topic of self-disclosure, we have to consider the process. It is important to consider the content, what information is actually disclosed, but also the process. Was the process thought through? Did the clinician take a step back when they heard a request for self-disclosure, or when they felt the need to self-disclose? Take that step back and say, does this make sense? Is this helpful? So we have to respect the idea of revealing versus knowing and the process of self-disclosure. Now, as I mentioned, there's mixed results in terms of the research, but generally we know there are some pros and cons, of course, to self-disclosure. On the pro side, one of the ones we hear a lot is that it builds rapport and it builds trust. And on the con side, we often hear that it causes role confusion and it can create an expectation that the client is supposed to share information now. So if the counselor spontaneously self-discloses, then there's this pressure for the client to self-disclose. Now, there are other cons too, and I think when I look at self-disclosure overall, I probably see more cons than pros, although I can certainly see it's appropriate sometimes. But in terms of other cons, it could meet the need of the clinician more than the client. That would definitely be a negative and inappropriate. It could also tend to exploit the client, and it could place a burden on the client. So there are a lot of pitfalls when considering the use of self-disclosure. So I discussed earlier the process of revealing. So what should a counselor consider as part of this process? Well, one is that the same disclosure could help one client and hurt another. So it's very important to consider the context. Also, it's important to slow down. When a request is made for self-disclosure or a counselor feels the need to self-disclose, that's a good time to slow down. Other than the mandatory disclosures that depend on where somebody lives, like potentially license status or training, as I mentioned before, a counselor does not have to self-disclose. So the counselor always has the option to really take a step back, take some time, and think about the best course of action. And finally, if it's difficult to figure out whether a self-disclosure is appropriate, seek supervision. Supervision is a process that's helpful for counselors in general for a lot of different areas, but specifically it does help with determining these type of boundary issues. And really this controversy around self-disclosure, or this technique of self-disclosure, depending on how you think about it, is really a boundary issue. And I think supervision is almost always a good idea when somebody's in doubt about how they're practicing counseling. I hope you found this description of self-disclosure to be interesting. Thanks for watching.